Someone recommended that you should get an injection. The question, what type of injection should you use? Because there are different types of injection. There is the cortisone, platelet-rich plasma or PRP, or the plasma injection, the stem cell, or the hyaluronic acid that could be also injected. The question is, how do, as a physician, choose the right injection for the patient? Or how do I choose as a patient the right injection for me? Now we're talking about scientifically, we're not talking about what the insurance covers. So for instance, I try to avoid steroids as much as possible. The steroids, because of the negative effect for the steroids, and it does not give you a long-term effect. However, if the patient has an inflammatory process such as a gout or rheumatoid arthritis, if the patient is in severe pain or severe symptoms that I want to give him an immediate or quick relief, then I choose steroids. Steroids can be injected inside the joint or can be injected in the spine for an epidural. However, if the symptoms are not severe and the patient can wait for the relief, then I go for platelet-rich plasma or PRP, which is a lot better than the steroids. I can inject the PRP or the platelet-rich plasma inside the disc. I can inject it as an epidural. I can inject it in the joint if the patient has a tendon problem in the joint or a cartilage problem in the joint. Now, the issue with the PRP, it takes about a week to 2 weeks before you can see the effect, because it's not immediate effect. However, there is some remodeling component to the injection. So the injection, the platelet-rich plasma or the platelets produce cytokines. Certain cytokines have the anti-inflammatory component to it, similar to the steroids. However, it's also some cytokines have the remodeling component to it by inviting the stem cells to come and remodel the area. So you get some remodeling. But the effect of it is delayed, so it starts about a week to 2 weeks after the injection. However, it is a longer term effect than the steroids. Now, if the problem is mild to moderate, then I go with the platelet-rich plasma or the PRP. If the problem is moderate to severe or severe, then I choose the stem cell therapy, because stem cell injection will help remodeling, will help improve the symptoms, and I typically combine the PRP with the stem cell. We can put the stem cell inside the disc, we can put it in the joint if you have a tendon problem or if you have a cartilage problem. So if you have severe also osteoarthritis, it helps with the remodeling. Now, for the hyaluronic acid, and it comes in different formulation, different concentration, it is FDA approved for mild to moderate osteoarthritis of the knees. Typically, it does not have any remodeling component to it. It's only lubricates the joint and gives you effect on an average for 6 months. So I try to avoid it if possible, unless I'm limited by what the insurance covers. So to summarize, if I have to choose, I try to avoid steroids. However, I give steroids if I want a quicker effect and if you have an inflammatory process. If you have a mild to moderate issue, then I use platelet-rich plasma because there is a remodeling component to it. If I have a problem that is moderate to severe or severe, I go to stem cell therapy. And if I just want to lubricate the joint and give the patient a relief of knee pain, then I might use hyaluronic acid. Thank you.